Afternoon, everyone. My name is Jane Walker, and I am with the Family Run Executive Director Leadership Association, aka FREDLA, and I'm very happy to welcome you today to Office Hours, the title of which is Amplify Your Family Run Organization's Voice, Social Marketing for Family Run Organizations. This is hosted by FREDLA, and we are pleased to be a partner with the National Technical Assistance Network for Children's Behavioral Health, operated by and coordinated through the University of Maryland, and of course, funded through SAMHSA. So, office hours are really different than a webinar. And so today is your chance to ask questions. We have done a full-length webinar. It's 30 minutes long with an in-depth discussion of social marketing for family-run organizations. And that link will be available to you in the chat box and also at the end of this presentation. And so we hope that if you haven't had a chance to listen to that webinar, that you will take a moment and listen to it. We're encouraging family-run organizations to share that webinar with their boards of directors, have it at staff meetings with volunteers, even listen to it with family-run, with your family, I should say, so that it can kind of give you a jump start into the world of social marketing. We know that many of our organizations have very limited staff and even more limited budgets. So this emphasis on social marketing will hopefully help you in many ways to get your voice heard in all of the places that you want it to be. One could call this Social Marketing Month for family-run organizations. I mentioned the recording that's available, and in addition to that, this is office hours. That is your opportunity to chat with our social marketing experts today, Cameron McDonald and Aaron Check. But then, in addition to that, every Thursday during August, FREDLA is hosting a 15-minute media guide. This emphasis on those 15 minutes are just about social marketing platforms. Last week was our first one, and it was on what are the social media platforms. Tomorrow at 3 o'clock Eastern Time will be a 15-minute just on Facebook and all the different options available to us that you may not be aware of on Facebook. Likewise, the one after that, I believe, is on Twitter, and the last one in August is on marketing with $0, something we all know is very important to all of us. So consider August Social Marketing Month for family-run organizations, and we hope you can take advantage of the multiple opportunities to kind of jumpstart social marketing for your organization. All of the opportunities I mentioned are completely geared to family-run organizations. I know a lot of social marketing focuses on systems of care, rightly so, but we're hoping to really emphasize the social marketing from the aspect of a family-run organization and getting messages out to families directly, getting messages to funders, getting messages to legislators, and all of the audiences that we all need to be reaching. So with that said, I would like to turn it over to our two social marketing experts that we have been very fortunate to have working with us this summer. Cameron McDonald, who is the Communications Manager for Families Together in New York State, and Aaron Check, Social Marketing Consultant, who really comes with 18 years experience in social marketing with nonprofits. So Aaron and Cameron, I'm going to turn it over to you to do a brief overview of social marketing, and then we're going to open it up for questions for people on the phone. Okay, take it away.
Oh, it looks like you may, oh, there we go. I think you're muted.
Oh, thank you so much, Jane. Thank you all for the introduction, Jane, and thank you all so much for joining us today. We're just so happy that you are here, and we are excited to go over some of the questions that you might have regarding social marketing in our presentation. For those of you who did not catch this, the social marketing webinar that Cameron and I had presented really went over the 7 big picture stages of the marketing cycle, really to make your marketing campaign successful for your family-run organization, which really kind of goes over some big picture objectives, setting your marketing goal, identifying your audience, developing your messaging, identifying the marketing channels that you want to deliver your marketing messaging, and developing activities and events around those marketing messages and channels, implementing your plan, and then analyzing all of your efforts. And it's what we call the social marketing cycle, and it's very effective when you use it to implement any new marketing campaign for your organization. Here's just to kind of back up a little bit to kind of go over social marketing. It's the process of using marketing techniques to change behavior that benefits society as well as the target audience. So really to implement change. Most businesses out in the world will create a plan to market their or advertise a product to motivate people to buy a product. Social marketing motivates people to change their behavior. It's very important work. Here's an example of sort of a social marketing plan. It's a grid that we follow, and it's a great planning tool to start implementing for any marketing campaign that your organization is putting out in the world. You naming your project, creating your vision and your mission, developing your goal, identifying your audiences, your messaging, the channels, everything that I had just kind of gone over. This is really great if you could print this out and even stick it on a wall and use it in a brainstorming session with your team. It's a wonderful planning tool, and it's a great way to kind of get everything all organized in one place. SAMHSA developed this, and it's just a great planning tool. Oh, I see a lot of people are joining us. Wonderful. Hello, everybody. I see Ann Goldman, Barbara Huff, Phoebe Malloy. Wonderful. Thank you all so much for joining us. This is an example. We have got many grantee sites who are using SAMHSA funds to put forth their marketing campaigns. And there have been so many wonderful examples that were provided to us that we have in a resources link at the very bottom of this presentation for you to see what other family-run organizations are doing. This is one example that we wanted to share with you of a marketing message from one of your fellow family-run organizations that really utilized the marketing, what we recommended in the marketing cycle, essentially, which is keep the copy brief, keep it resonating with your audience, to speaking directly to them and what their needs are, and utilizing storytelling. Stark County, Ohio Mental Health and Addiction Recovery Center put this wonderful minute-long YouTube promotion together, which really did a great job of hitting all of those points. That's all I have to say really for this. Another example is through the Texas System of Care. This was an example of utilizing a marketing channel in a really great way. So they developed T-shirts with their marketing message. So the T-shirt was the marketing channel, and Flight to Freedom from Stigma was their marketing message. And they delivered that through grassroots marketing. So people wore the T-shirts and around their community, and it really conveyed the message that they wanted to convey to their target audience within the community. Another really great example. So as family-run organizations, you know, our passion is the children and the families that we serve. Sometimes it's difficult to think of marketing. It takes us away from our mission and what we're trying to achieve on a day-to-day basis. But in marketing, the rule of thumb is out of sight, out of mind. So it's really important that you get your voice out there and you get your voice heard. It's a really powerful way to bring our message of children's mental health needs to policymakers, funders, new patients, and they're messages that really deserve to be heard. So I really feel like if you follow the social marketing cycle and you utilize Cameron and I as resources through the beginning of September for technical assistance, you really can make your marketing campaign be very successful. So at this point, you know, the final slides are, oops, looks like that got cut off a little bit. We'll resend a new link. But these are some really great resources for you all to access. We've got some tip sheets that the University of Maryland created. I think the next slide might be some of the examples from other family-run. This one was some identifying your objectives and how to segment your audience, a worksheet for you to just plug in your own information with your audience. I believe the next slide then are probably examples from other grantee sites of how they utilize social marketing. These are great. The Stark County, Ohio's Mental Health and Addiction Recovery family-run organization, these are the YouTube videos that they put together that really do a great job with messaging and utilizing marketing channels and storytelling. And I believe the next page are some wonderful examples, even the next page, sorry, are some great examples of ECO recognition program winners. And Jane, did you want to talk really quickly about this award? So basically these are family-run organizations who have won awards for the marketing work that they've done.
So the ECHO Awards used to be given out for social marketing recognition. They were often given out during the training institutes that Georgetown hosted. To my knowledge, they're no longer in existence, but what we have for you are examples of those award winners and different messages, different activities, different ways in which they got their messages out. They're really not all family-run organizations. They're systemic care sites, but the family-run organizations were very, very involved and had a strong component. A lot of them focused on children's mental health awareness, which is certainly something that our family-run organizations own in many of our states and communities. So that's the ECHO Awards, and what you have there are examples of the award winners. It was very competitive. Probably several of you on the call are familiar with them, may have entered into the ECHO Awards or been ECHO Award winners, so you know at the time how very good they were to recognize good social marketing. So those examples can be very helpful to you. Again, in conjunction with utilizing the recording on social marketing and then looking at some of these examples and the tools that Erin and Cameron have for you, such as the social marketing plan and social marketing cycle. Okay?
Thank you so much, Jane.
Thanks, Jane.
It's at this point that we'd like to just to open up the office hours with any questions that anybody might have regarding the webinar that you viewed. Any questions about what you've heard today? We'd love to hear from you.
Okay, so since we have a few people on,
we will go ahead and use that raise hand function for folks who do want to speak. So if you are looking at your screen and right above the camera pod where you see our lovely presenters today, should be a raise hand function. So go ahead and click on that raise hand function, and we will go ahead and unmute you so that you can go ahead and chat with our presenters today. And also feel free to put any questions you have in the chat box as well.
So I'd like to start with a question to those of you who are on the line, and that is, how have you used social marketing? Has it been mostly in the area of children's mental health awareness, or how have you marketed your organization and the services that you provide? Anybody on the call? Go to that little guy up on the top and click on raise your hand, and then the lines will be open so you can share your information. We have a lot of people on who'd like to just hear what other people are doing. So, two-part question. What are you doing related to children's mental health awareness? And secondly, how have you used social marketing for your organization to market your services?
Also, feel free to type in the chat box too. And if you have any questions, you can also type those in the chat box, and we can address those too as they come up.
I'll share with you, when I was the director of the Maryland Coalition family organization in Maryland, one of our major activities during Children's Mental Health Awareness, this kind of dates me, was we organized a flash mob that was held in downtown Baltimore, and we had purchased banners that went across the street about children's mental health awareness. We had a video made of our flash mob, and it was circulated all around the state and on the news. So it's a great opportunity to really utilize May to get those messages out there. And I think that's where a lot of us focus our energy. So if anybody has any other great experiences around children's mental health awareness, and also around how you marketing. Okay, so Anne has said, constant contact flyers directly to your list and on Facebook. And join us tomorrow on Facebook. 15 minutes out of your day to talk about all the different things that you can do with Facebook that I certainly never knew. But then I'm not on Facebook.
And yeah, as I'm sure your organization knows, constant contact or email marketing and Facebook are both really, really excellent ways to be reaching out messaging. Yeah. I mean, you can basically reach any audience these days through those two platforms. So that's a great way to do your messaging or send out your messaging. I don't know, in our slides, I'm going to look back to our slides real quick. I don't know if our social marketing cycle made it in here, but I was going to share an example that kind of follows that along, but I don't see it.
Yeah.
That's okay.
You can access, one of the stages there.
Yeah, so I can give you guys an example from, my work here in New York for Families Together. We had a policy priority one year to raise the age of criminal responsibility in New York State, for example. And it was something we were working with the legislators on and the governor's office for a long time. And we weren't making, it was like 5 years in the process. We weren't making much headway. And we finally got it passed. But we did that by using the social marketing cycle and changing opinion on it throughout the state, not only with the politicians, but also with the public, too. And also, other actors within that, that situation, like the Correctional Officer Association, that sort of stuff. So that was our audience. And so our goal, let me kind of follow the cycle here. So our goal was to raise the age of criminal responsibility in New York State. Our audience was, the people I mentioned there, both the public and the politicians. Our message was different depending on, who our audience was. For the politicians, it was especially like, let's say it was a conservative politician maybe, and they were wanting to look or appear tough on crime, and they saw, this is maybe something that would make them, maybe appear weak on crime. Our message to them, and we had data to back this up too, data always helps, was that it actually shows that it improves public safety and also reduces recidivism for, the children that were going into this system, the justice system. So those were two positive things that they could take back to their, neck of the woods and say, well, these are the reasons we are supporting this now. And then for the public, actually, we had similar messaging. The big one for the public, because there were a lot of people that were against, they were like scared kind of that if we do reduce the rate or the age, or I'm sorry, raise the age, that, more criminals might be out on the street was their understanding. But we showed that the data increases public safety. So we were able to use that message through certain channels such as Facebook, blasts, through, I think we did some television ads, we did some advertising through Twitter, we did some email ads, just like, who was it, Zafina was mentioning. Yeah, so those were our channels we sent these different messages through. And then we, as we, over those 5 years we were doing this, we would look at what the data from those emails, like how many were opened, or how many people on Facebook clicked this link to learn more information about Raise the Age. And we were able to see what worked, what didn't work, and that would be the pre-testing and implementation part, and also the evaluation and mid-course correction. So based off what we saw, that data, we were able to say, all right, well, this worked, this didn't work. So now we're going to change it up a little bit, and we're going to go through this entire cycle again. And now our goal may still be the same, but maybe our audience changed. Maybe we weren't reaching the right people or the right politician, or maybe our message is changing. Maybe it wasn't sticking with the people or the politicians. So, or our channels were wrong. Maybe they weren't, Facebook wasn't the appropriate one, for example. So those are all, those are examples of just one goal we had where this cycle really helped us. And eventually we did, get the law passed, and we had, it was passed last year or so. So, this actually, that's the cycle working and actually changing, thousands of lives.
Wow, Cameron, that's a great example of how you utilized every stage in the marketing cycle and then went back and reevaluated.
In fact,
that's great.
We use the sheet that's right up on the page right there in front of you. We actually use that as an organization ourselves, the SAMHSA document here, the name of the project, the vision, mission, program goals, etc. And that kind of lists it out for you here, which is really nice because you can kind of break it up and segment it and keeps you on track. And it really helped us. So I definitely recommend using that.
Mm-hmm.
So
now I see that there are a few additional questions from participants here. Is it Delphine and Phoebe have some questions? It says press 6 to unmute.
Delphi was just making
star 6.
Yeah, go ahead. Delphi,
I think she
you
also
want to talk? Okay.
It looks like star 6 to unmute on your phone.
So Delphi made a comment and said that she didn't want to, didn't need to speak, but I think her point is a really, really very important one for family-run organizations about getting your message out without sounding desperate. Do you have any thoughts about that, Aaron and Cameron? Because oftentimes our organizations, funding is very precarious, and we are desperate for funding. But I think Delphi's point about coming across as desperate isn't helpful to us. Do you have any thoughts about that?
Well, yeah, so it depends on what your, your goal is here. So sometimes, so it sounds like maybe you're talking about getting funding, and desperate is not always bad in that case. I mean, you want to frame it in a way that, you're not coming off like you're coming to them begging, but you do want you do want to express a need, and that's where the messaging comes in really important. First off, you're making sure you're talking to the right person. That's a big thing. So that's your audience. And are you talking to the right person? Funding would be a big question. So see who your audience is and make sure that's the right, people you should be talking to. Let's say in this example, receive more funding from the state. And then your messaging, like what have you been saying to them? And if it's not been working, maybe it's time to revisit that. Has it been too doom and gloom, saying perhaps, well, we're in a really tight spot right now, like funding would help, but we're just really in a tough spot. And, maybe if they hear that sort of messaging, they're not prone to give you those, that extra funding because they're saying, well, I mean, they're kind of struggling anyways. Why would we give them that money? But you could spin it around in a way that's really positive, saying, listen, we do this, this, and this really well right now, but, we could do a lot better in these areas, and we could do A, B, and C, improve children's mental health in the state, et cetera. And then you list these positive things for them, and then, hopefully that messaging, that little change in messaging right there actually might, get you better results. And then the channels too, same kind with the audience. You just want to make sure you're going back and looking at that. Are you just sending them emails? Because, I mean, from personally working inside a politician's office before, I worked for a senator here in New York, like, they don't see those emails. And a lot of times the staff doesn't even see those emails. Are you calling? Are you guys calling a bunch at once? Or are you setting up personal meetings? Oftentimes, as you know, with funding, a personal meeting might work better. You call their scheduler and they get you on their calendar, hopefully, depending on how accessible that politician is. And yeah, so that might be something you want to take a look at. There's, different pieces of the machine here that could be either hindering or helping you, reach your goal, which is, in this case, this example from that Delphine is giving us, funding from the state. So those are all things. You just want to look at all the different variables and, manipulate the things and take a really close look at them. And I know time is a thing here too, but with sheets like this, the one in front of you, it actually doesn't take too much time. And also, sometimes the more the better too. Maybe you've been having 2 people work on it or only 1 person work on it. Bring in other people in your agency or talk to other state or your organization rather, or talk. And if there's not that many people in your organization, maybe reach outside your organization to similar organizations, either in your state or out of your state, and see what they've done too. Communicate with them. That actually is social marketing within itself. Is the social aspect, talking to people that do similar work as you.
Yeah.
And I agreed with.
I was just going to say, I think too, having your board also speak on your behalf.
Yeah.
Sometimes as executive directors, when we go, it's like, I think they view it as self-serving for us because we want to keep our jobs. Could be the way they're looking at it. I don't think it's accurate, but I think that could be the way it's perceived. So if a board member is, hearing your message, so Cameron's point about thinking it through strategically is a good one. I think I'll just speak from my own experience. I've learned a lot from both of them in this relatively short time, and would say that my approach for however many years, 15 years in Maryland, was a scattered approach in that, okay, we have this program, let's put out a flyer about that, without methodically thinking through exactly what's on this plan, that who is our audience for whatever program it's going to be, whatever initiative it's going to be, and how do we reach that audience. And right. I think Cameron and Aaron, both in the webinar recording and also in the ones that they're going to be presenting, I've learned that different platforms appeal to different age groups and different audiences. And they have data to share on that, to tell you how to target your message on which platform. So join us tomorrow on Facebook. You'll learn that. Listen to the recording. But I think there's, being very strategic. And Delphi, I thank you for sharing that point. It's a critical point that we don't want to come across desperate. Yeah, very good point.
And it looks like Phoebe wrote this. They've used billboards before to promote awareness of children's mental health, and that's a great idea. So, like, let's say Phoebe, I don't know what state Phoebe's in, but let's say what state, or that she, her state has some data that came out that says, there's not as many, there's not as much, public support for children's mental health, let's say. And being a children's mental health organization, you guys, or a family-run organization that deals with that, you guys might, obviously you want that to be higher because that helps you guys receive more funding, helps you guys pass legislation you might be working on. That public support is really important in this sphere. So it sounds like maybe that Phoebe's agency saw, or organization saw, that there wasn't enough public support, and so what they did is they did a kind of a shotgun approach, which I always call that like with billboards or TV advertising. I kind of call that a shotgun approach, because what it does is it's a lot of eyes on that marketing, but not necessarily everyone's seeing it. It's not relevant to everybody. They might just miss it completely because there's how many billboards on the interstate. But it does hit some people, and so they were changing possibly public opinion, at least in that local area or wherever those billboards were around there, and hopefully raising that public opinion up on the need for those services or for funding, etc. So that's a great example right there. And it sounds like they thought of who their audience was, and they saw the goal because they saw a problem and they had a goal, which was increase public support. Their audience was the public in broad sense this time. Their messaging, I don't know what the billboard said, but probably was good messaging if they worked with a billboard company. And then the channels was the billboard itself. And then they saw maybe, was there an increase in support publicly around the state or around that area? And now they can evaluate that and, by surveys or different sort of different metrics, like did they get more website visits? Did they get more people following their page, et cetera? Those are all metrics you can kind of see to see if your marketing is working. And then based on that, they went back and maybe said, all right, well, do we need to do this again? Do we need to pay for this again? Has it worked already? And they reevaluated, and that's kind of the whole cycle right there. So that's a great example too. What else we got here?
I think.
Hi, Phoebe.
Phoebe keeps popping up our screen, but we can't hear. Yeah.
Have also shared about utilizing board chairs representing the consortium that they have in New Jersey and going to the commissioner, which had a very good reception. And the commissioner now knows who they are, and that headhunt adding families are also effective and tie in the very personal human aspect as well as talking about the outcome. I was going to talk about that too, kind of getting back to that original conversation about the outcome when they were worried about coming across as desperate. I think sometimes saying too much can make someone maybe come across as a little desperate, so keep it brief and keep it very direct. That would be my advice as a copywriter for many, many years. And think about what motivates your audience, not just what you want to say. If you look at it from what they need to hear and you kind of approach your writing and your messaging that way, then you can serve them something that may resonate more with them, if that makes sense. Not to get back to that, but Jane, you had read Pat's comments, and that kind of went over that as well. So maybe maybe the person that you're trying to reach is a father. So approaching that person with the messaging from a family point of view, that sort of thing. I'm sorry, Jane, and you were reading the comments. I just wanted to kind of jump in there. Yeah, good point. Good point. Yeah. Did Phoebe want to add something here? I think she was trying to ask a question or make a comment.
We saw you a little bit, Phoebe, and then you disappeared.
When Phoebe's figuring that out, I have seen a lot of people writing in the chat box saying that they use word of mouth too, which oftentimes people when people do that, and it's obviously person to person. It seems like it's maybe slow and ineffective, but it's really, really not, especially depending on the area you are.
Yeah.
So, maybe if your organization in New York City, word of mouth, it will get you some places. Obviously there's a lot of people, and your name will get around. But for areas like really rural areas, maybe like upstate New York or out in the middle of the country somewhere where there's no big city around, small towns especially, that word of mouth can be the biggest marketing you have right there.
Absolutely. Yeah.
Radio advertising, it can be more effective than being on the news. That word of mouth, especially in smaller communities, can be huge. So that's awesome that you guys are doing that too. I would always encourage that.
Yeah. You're
Absolutely. Word of mouth. And depending on your approach, it can be the most memorable.
Yeah.
Absolutely.
We hear over and over again in our Fredla surveys about how did families learn about your organization. And always the top reason is word of mouth from another family. So you're right. I'm glad you brought that up. Very good.
Absolutely.
So, yeah.
Now, I have a question while we're waiting for some additional questions to come in. I'd be curious to know if anybody has utilized brand ambassadors, whether that be people, walking around handing out flyers or brand ambassadors online. Have you mobilized groups of loyal followers on your social media pages to spread the word, to share your posts and share your content?
To give you guys an example of what she means, I keep going back to this example, but when we were passing that law, Raise the Age, we had a really, I'm sure many of you have heard of him, Sean King. He's a really big activist and all around the country. And so he lives in New York City, and he was behind, our cause and that social justice. He's a big social justice guy. So he was behind our cause. And so, here talking to the campaign, the Raise the Age campaign that we were involved in, he actually sent out, I think it was either one tweet or one Facebook, I can't remember, but I think it was a tweet with both our organization's Facebook information and Twitter information. And then within a weekend, I left, that was on a Friday, I left work that Friday. I come back Monday, we had almost 1,000 new followers on our, and that's been by far the largest increase we've ever had and probably ever will have, because this guy, he's a really big, he has probably millions of followers, but influential people like that within your community, whether it be a politician within your community, a smaller community, or if it's, somebody that's known nationwide like that, if you guys can get somebody like that has a lot of followers and a big microphone, or, then, metaphorically a big microphone, if you can utilize people like that, that's social marketing right there, and they can really, really help either increase your, the eyes on your cause or your goal rather, or they can increase your at least numbers on your Facebook site or your Twitter accounts, and that will increase the people seeing your messaging. So that kind of works with each other. So I think that's kind of an example of what Aaron was giving. If anyone else has examples like that, they'd reach out to community leaders or a kind of a rock star in their community. Metaphorically a rock star in the mental health community or something that have kind of helped me like that before. Feel free to share your examples either in the chat box or, talking to us.
We've seen that a lot of sports figures do that and really move a cause forward. Certainly Michael Phelps is talking a lot about mental health now. Yeah.
Absolutely.
So that's an excellent point. Right.
Yeah, that's a great example.
And we try to share that stuff as much as possible, though. Whether or not, they're directly talking about, our organization specifically, or they're just talking about mental health, the need for, more awareness about mental health in general. We try to share that stuff because not only does it, it generate a lot of likes, comments, shares, that sort of stuff, which does bring attention to our page, but also it gives people a lot of hope and inspiration, too. And, people don't necessarily remember what you say, but they remember how you made them feel. And so if you're making them feel that way, then they're remembering your organization, and that's the goal here. So, and then think about that during your messaging as well. Not necessarily, obviously you have to think about words, but think about the feeling behind those words as well. That's a huge thing, and that will help you guys a lot when you're developing those messages.
Absolutely. That's a great point.
I think the other thing I would add is the power of thank you. And following up after we reach out to somebody, and whether anything happened or not, just making a personal thank you. So, and I think that helps because when you go back again, they have, as you said, a good feeling, Cameron. and
Yeah.
they're more apt to be receptive to speaking with you, meeting with you, and hopefully even supporting what it is you want. So.
Yeah. And, that's something I don't know
Absolutely.
if we mentioned inside our presentation, but if we did, I don't know if we mentioned in the initial presentation we did, or that, you guys have all watched already, hopefully. But, yeah, that going back, as Jane just said, is really important. Finishing the job, like you might have went to a politician's office and said your case and you had a really good message, but you didn't really reach out afterwards too. And that's really kind of towards the end of the cycle, realize like, all right, well, did this not work because we, didn't do enough engagement after, because we had this guy really interested, but maybe we didn't keep that ball rolling, So that's something to consider too. And we never brought that up in the initial one. Yeah,
right.
So that's really important.
Part of the evaluation. And so to back to Delphi's point, if someone is, and not that this is the case, Delphi, but always going for the ask without the follow-up thank you, and just keeping them up to date, and the only time is when there's an ask, then it can leave people with it can turn them off, I guess I would say.
Yeah, especially when it comes to funding. I've noticed, just trying to receive funding for our organization personally, a lot of the people I talk to, whether they're institution or a private loan, people, I'm sorry, whether it's private or it's coming from the government, federal or state, they are approached every second of the day by people that would like some funding, and that, especially politicians and especially organizations that actually just give money out for these sort of things. And so they're hearing message after message after message. So just like these billboards we were just going down the highway earlier, eventually you might notice the first billboard if you're driving on a highway, but if you're driving on a highway for 10 hours, you're not even looking at them anymore. They're not registering to you. So think about that when you're doing your messaging too. How can you stand out? And also what Jane said too, one way to stand out is being appreciative afterwards, because a lot of the time what kind of happens is, well, all right, we gave you guys money last year and we never even heard back from you, or we you never told us what you did with it, or we didn't hear anything back. You got what you wanted, we didn't really hear anything, like even a thank you. So that's a super important point, and especially when you're looking for funding. So I'm really glad Jane brought that up.
Yeah, building relationships is essential.
So, and in that vein, Erin, we talked about, different activities and messages around children's mental health awareness. We focused a lot on either legislative or financing with administrators, legislators. What about social marketing relating to other partners, other community partners, because you have to get your message out to them as well, either for referrals, for possible partnerships, things like that. Anybody on the call today have any suggestions about marketing, social marketing with your partner organizations, be they other family-run organizations, be they other providers, be they managed care organizations? How does your message change, and what approaches do you use with them that might be different if you were talking to a legislator or a family member? Anybody on the call have any thoughts about that? You can raise your hand and we'll call on you, or you can put it in the chat box. And how about Erin and Cameron? Any thoughts on that?
Yeah, so I think just kind of get their minds jogging here a little bit. We work with, they're not connected to us in any way really. They're their own organization, but we work with a chapter of NAMI here in Albany, and we both work in the mental health field. Yeah, exactly. And not only do we share each other's messages throughout Facebook and Twitter, that sort of stuff, or events too, if NAMI's holding their own conference, we might share that, or vice versa, they might share our conference. But we've also come together before, and with them, and I think with some funding from our Office of Mental Health as well, we were able to hold a event. And events are a great great channel for getting your marketing stuff out there, whether it be physical marketing stuff like brochures or just word of mouth, especially word of mouth. And so to save, and I mean, this kind of goes into we're all strapped for time and definitely strapped for cash. I know we're strapped for cash. And part of the reason we joined with them is because they might be too. And so we, pulled our resources together and held this great event, and that, got a bunch of families there and also a lot of their population there. And it was, a way that we were able to actually put it on while it's still staying affordable and increasing, the amount of people that know us from maybe that world too. And so that's something we did to partner up with a different organization too, and that's literally the social marketing. So
yeah,
That's a good point.
I had a client partner with the local library. That I guess that's probably a good example. Really got into the community and was able to tap into the audience space for a local library. And he gave a talk at the library. They're always looking for programs to fill their speaking series and what they offer to their members. So I was able to arrange a talk at the public talk at the library for free, where they offered advice and tools. It was for a different industry, but it's just an example of how you can partner with another nonprofit in the community to get in front of somebody else's audience. And it was great. It was promoted on their website. It was promoted in their e-newsletter. And this person's information was out there in a very visible way. And, in turn, he had information about that public library and his collateral. And I think that there's something wonderful about that. Like, I scratch your back, you scratch my back kind of thing. You really kind of help each other. So he had information and his e-newsletters on his website and at his store promoting the library and the programs that they offer the community for free. So I think that's a great example of how you can partner with somebody and kind of help each other, get your message out and get your branding out there.
Yeah. And it looks like Ann Goldman wrote earlier up in the chat box. I missed this one earlier. She wrote something kind of along the same lines. So they posted flyers and what does it say? They posted flyers and she put social locations, and that means where families might frequent in this case. And she put some examples here too. I'll read them out: churches, laundromats, barbershops, and then as Aaron was just saying, libraries. And another great way too. And that's as we're talking about cost affordable ways, that's a really good way too. Because and to think about where is our audience too. That's when you think about your audience, which is one of the steps in the social marketing cycle. You not only have to ask who is my audience, you have to ask the who, what, where kind of questions. All those W's.
Where are they?
Right? So, so not only who the audience is, but where are these families? I mean, so we were trying to. I mean, for example, our organization was trying to increase the amount of people utilizing family peer support services, for example. And we found out that a lot of families didn't know necessarily that was an option, or that a lot of professionals even in that field didn't even know it was an option. So we targeted our audience as pediatricians' offices, for example. That was a target audience for a campaign we were doing. And then our messaging, we created a brochure, not necessarily, well, we created two different versions of the brochure. And one was for more so the pediatricians themselves, and I'm saying professionally, and using a lot of stats and kind of, that their sort of jargon. Here's the reasons why family peer support could help your patients. And then we also had some made for out in their doctor's office, like for the patients or for the families themselves in there. That said, here's a resource available to you. It's called family peer support, and this is what it is, and this is how it can help you. And so we used that. We thought about the messaging there between the two. Obviously, the doctor is going to be a little different than maybe when you're talking to the families. You're going to be using different languages, different images, and then the channels was the same. It was at that doctor's office, but we had two different messages we used there. And that's an example right there. And that was it was pretty cost effective too, and it worked too. We got a lot of interest in our services. So that's another example right there.
That's a great example. So really what you're saying, you're both saying, is that using this little simple chart and filling it in and being strategic when you fill it in. So using the example of increasing referrals for peer support, your vision and mission is to, help support individual families, and your goal is to increase the number of referrals. And then your audience is both the pediatrician as well as families. Your messages would be defined according to your audience as well as your channels. We haven't really defined channels, but what would channels be?
So channel would be, channel, that's a great point too. We definitely want to make sure everyone understands what a channel is. So a channel would be how that message that you've made is delivered to the audience. So like it can be a television ad, it can be a radio ad, it could be, the billboards we were talking about. Those are channels where a lot of people might see it, right? But it's not very specific. Or you can make a post on Facebook, or even a paid post on Facebook, where you can even select channels, your audience a little bit better. But that would be a more specific channel. Like anyone that's following your page is probably interested in what you guys do already a little bit. And so that is a channel within itself. Facebook, Twitter, any of those social media platforms. Email and your listservs, that's a channel. And or a brochure. That kind of falls under events or materials too. But the channel in that case, I guess, in that example I was using,
collateral.
The doctor's office itself too. So that would have been the channel right there, because that's where our audience was. So we used that physical location, and then we used the material, which was the brochure, in that channel, which would be the doctor's office. So that's really it's the method of delivery of your message to your audience. Think about it like that.
And then the activities and events. So you'd be, delivering to the pediatrician's office, or you'd be posting things at the grocery store, at the church, at the library, and then you'd be setting up
a table.
At an event. And then if you had a legislative initiative, you'd be going over the same thing, but your audience would be legislators, staffers. Your message would be very different. Your channel, maybe personal meetings. So just using this very simple chart for, a new program, a service you provide, an initiative, a legislative initiative, even to talk about your core funding, how will you approach for next year's budget cycle? Will all help to organize and strategize. And employing, as we've said, I'm just kind of doing a very quick summary here because we're wrapping it up. But employing your board, your staff, your families, and I forget the term you use, Erin, champions, or I forget the term you use, to get people.
Brand ambassadors.
Oh, brand ambassadors.
Or champions, to be working on your behalf. So kind of putting it all down in one page, and then, checking in on it and evaluating it. It can increase your effectiveness in reaching your various audience. So we have about 1 minute left. So Cameron, Erin, any last words other than join us tomorrow at 3 o'clock for Facebook?
Took the words right out of my mouth.
Okay.
Join us tomorrow. It's going to be very informative. We go step by step through all of the marketing behind Facebook. Kind of break it all down for everybody.
And just a reminder, the link to the recording is available. We'll be sending all this out to everybody, but
that's right.
Cameron?
Yeah, that's what I was going to say. I think that they listed the link to or maybe they didn't. Oh, no, they did. So the Institute, if you look in the chat box here, they have put the link in for the presentation we were talking about today in there. It's already recorded as a YouTube video. You can view those. And then the 15-minute ones we're doing kind of similar to these in the same vein, marketing, they'll be available, as Jane said, we'll be sending out to, this list of people here, and they'll also be available on like Fredla's website and stuff once we have them all edited and such, just like that YouTube video here. So keep an eye out for those.
It'll be a wonderful library resource for family-run organizations. So with that, it's 4 o'clock Eastern time here, and we will thank everybody for spending an hour with us. We hope you found it as beneficial as we did. Thank you for your questions, your comments, your ideas that you put in the chat book, and of course, always for your time. We'll hope to be touching base with you again tomorrow at 3 o'clock. All right. Thank you, everybody.
Thanks, everyone.
Bye-bye.
Oh, and our contact information is right here, just in case anybody had a question
Oh, right.
that they didn't have answered. Get in touch with us. We'd be happy to answer your questions. And if you could just send the email to both Cameron and myself, we can put our heads together and get back to you. But we would love to answer any questions that anybody else had that didn't get around to asking them.
So for this short period of time, this month of August, each of you on the call and family-run organizations across the country have the opportunity to personally get technical assistance from Cameron and Aaron. All right? So we're happy to be able to offer that. All right. Thanks, everyone, again.
Thank you. Bye.
Bye.